Hi, my name is Neeraja Reddy Malleda. I am board certified genetic counselor and I consult at Apollo Navi Mumbai hospitals. Today we are going to talk about why are genetic conditions and testing for genetic conditions important and what are the types of genetic testing that are available. So most of the health conditions, especially the common ones like type 1, type 2 diabetes or cancers or blood pressure, cardiovascular diseases or as we know heart attacks are most commonly considered to be chronic illnesses which are multifactorial. What that means is that genetics plays a role. However, along with the genetic piece, your lifestyle factors, your dietary changes and your family history are the other factors that will either increase or decrease your risk of developing these conditions. But not all conditions are like that. When we look at the remaining genetic conditions, for example, there are children who may develop seizures or fits at a young age. Sometimes individuals may have concerns during their pregnancy where the pregnancy is not growing much and end up having a miscarriage at an early stage of the pregnancy. Sometimes there are children who may look slightly different from their parents. So, for example, Down syndrome, which is a common genetic condition you may have heard about. Some of the cancers, for example, early onset breast cancers, usually the ones that occur before the age of 45, or prostate cancers in men that are spread to the rest of the body are called metastatic. These are some conditions where we would suspect an underlying genetic factor. So what are these genetic factors? So our entire body is instructed by a set of genes. Genes are nothing but a code that is written in our body that helps us function. So to give you a simple example, if you were to make a particular dish in your kitchen, you follow a recipe. So our genetic information is nothing but the recipe for our body. It tells our body how to function. So this entire genetic code is written by 4 letters, A, T, C and G. So just simple permutations and combinations or just a different way of writing these letters makes up our entire genetic code. 99.9% of our genetic information is the same amongst all the human beings. There's 0.1% that differs. This 0.1% makes us unique from one another. So that is why we all look different, we speak different, and we have different personalities, and we also have different health-related issues. This 0.1% is also what is responsible for some of these health conditions that we have. So when we do genetic testing, what we do is read the genetic code to understand if there are any changes that directly causes a health condition. Most of the times, the changes that we identify just makes us unique from one another, or that we don't have enough evidence to show that it causes a genetic condition. So now let's talk about what can we do when we identify a genetic condition. So when we do a genetic test, the goal is to help us understand what the health concerns are, if there are other health concerns that we should be aware about. What are the management strategies that we can use? So for example, are there treatments available for them? Are there surgeries that are required? Is there any medication that we can give to provide relief from the symptoms or even fix the symptoms and cure the disease? And then we also want to understand if this can have implications on family members, so brothers, sisters, children, or sometimes even parents. Okay? So genetic information can help us understand how to manage the condition, what to look ahead about, and also to help us provide a recurrence risk, meaning what is the chance this can happen again in the family. Now let's talk about the types of genetic testing. So like I told you before, your genetic code is written by 4 letters, A, T, C and G. So all of this genetic information is essentially packed in chromosomes. We call these structures, there are 46 structures and these are referred to as chromosomes. So all of your genetic information is packed in these 46 chromosomes. Now if I were to give you an analogy, think about this. You have a big book that is your genetic information. All of your letters are your genes. Now these are packed in 46 chapters of the book. Each chapter is referred to as a chromosome. So genetic testing are done at different levels. Sometimes we do it at the level of just looking at whether the chapters are present and if all chapters are arranged in the right order in your genetic book. Sometimes we do genetic testing to understand if accidentally some of these pages from these chapters have been taken off or if some of these pages are added or are extra. And then the third type of genetic testing that we do is more like a spell check that you would do in your Word document on your computer, where you are reading for different alphabets and you're trying to understand if there is any spelling error or if grammatical errors that are present in the book, the content of the book that is provided to you. So genetic changes of all of these types can lead to certain genetic conditions. If there is any concern for you or your family members for a genetic condition, when you meet with a genetic expert, whether it's a geneticist or a genetic counselor, we will try and understand what is the genetic condition that they're concerned about, and based on that, the type of genetic testing will be ordered for you. Sometimes more than one test may be required for us to reach a conclusive answer. It's also possible that sometimes genetic testing may give us certain direction, but may not completely answer the question about what is the genetic condition underlying your health problems. However, as advances in medicine is happening and there are more research in genetics, we are getting more and more conclusive answers, and we are able to help families more to identify the health concerns, the underlying reason, and also to understand what the future may hold for them. Thank you.